Seclusion. Use of seclusion as a means of restraints in residential aged care in Victoria. Can a resident be confined on their own in their aged care facility? In Australia, an aged care resident generally has the right to move around their aged care facility freely, except where there may be a risk of harm to the resident or others. If a resident is left on their own in any area of the facility where they cannot exit, or it is implied that they cannot exit, and this is done for the primary purpose of influencing a resident's behaviour, it is known as seclusion. Seclusion is a restrictive practice because its use restricts a person's rights or freedom. It can only be used as a last resort to prevent harm. Examples of seclusion include locking a resident in their room or other part of the facility, or staff and residents leaving an area where the resident is unable to leave and is left on their own. How to recognise when seclusion is appropriate or inappropriate. Example: Jim has dementia and likes to sing loudly. A staff member becomes annoyed with Jim's continuous singing and leaves him in an area of the facility on his own. Jim is confused and cannot walk back to where other residents and staff are located as he needs assistance to walk. This is inappropriate seclusion, as Jim has been left in an area on his own where he cannot leave without assistance. Secluding Jim was not to prevent harm and is therefore inappropriate. If Jim's behaviour is harmful and involves violence towards others, secluding Jim for a short period of time as a last resort to prevent harm to others may be appropriate, if all obligations are followed. Some of the obligations that an aged care provider must follow when secluding a resident include: 1. Alternative strategies should be considered and attempted to help change the behaviour of the resident. Such strategies must be documented. They might include talking with the resident, using relaxation techniques, or changing the environment to make them feel more comfortable. 2. A health practitioner with day-to-day knowledge of the resident must assess if the seclusion is necessary to prevent harm. 3. Obtain consent to the seclusion from the resident or the resident's restrictive practices substitute decision maker if it is determined that the resident cannot make their own decisions. 4. Monitor the resident while the seclusion is in place to assess whether the restraint should be reduced or stopped. In emergency situations, trying alternative strategies and obtaining consent is not required at the time of the emergency. For more information on seclusion or to arrange a free legal consultation on an issue related to aged care, please visit agedcarejustice.org.au or email info@agedcarejustice.org.au.